Good afternoon, everybody. It's Friday the 10th, and once again, we've got another lovely sunny day in Nelson. Even though it's a bit colder than normal, it's great to see the blue sky and the sun out. I thought I'd just give you a bit of an update on a couple of things. The first is we had the Strategic Planning Day, I think it was last week sometime, and that was attended by the board, both boards, Innovation Investment Trust Board and our Operational Trust Board, as well as our leadership team. And we did have Kathy O'Malley, who's the Strategic Planning Advisor or General Manager, whatever her position is at the DHB, join us for an hour and a half. So yeah, it was a very, very good day. It was facilitated by a lady who came over from Wellington, who does that for a living. She was excellent and has pulled together a really good paper for us to start using going forward. So basically, the main strategy, and I'm reading from a document, says that we need to take a leap, a bold and innovative hospice, meeting our community's future needs. Um, to do this, we need to have a united team, taking chances together and working towards that shared vision. We must be true to our values, rewarding, developing, and challenging our team, encouraging people to embrace change, and having fearless conversations when needed. We must be innovative in our vision for our services, making a strong case for change and working with our funders and sector to change how we work to anticipate and meet our community needs. And we must clearly communicate this vision of our service and actively engage with our community, telling our stories and building on connections. So that's quite a challenging a list of things in their broad strokes. And basically, what we'll do from here is start to developing action plans around that. Um, so we will share this document with you probably in the next week or two, and then we will start looking at how we can actually develop some of those plans around that. So um, when we do share that document with you, we would like some feedback, some comments. Tell us what you think, and we'll see if how we can potentially add some of your comments and ideas to that paper. So yeah, quite exciting times. We've last we worked on a strategic plan was 2018. It was well needed, long overdue, and to have goals in front of us will make, I think, a significant difference in how we operate. The other thing I wanted to just briefly talk about was the staff survey. So we finished the staff survey, I think, towards the end of January, early February. Ruth has collated all the information, all the comments. There were over 400 comments, and we now have a PowerPoint presentation, and we're working on some action plans to try and improve in those areas that we found that we've not as strong as what we should be. So that too will be coming your way fairly soon. And we're not quite sure how we communicate that with you. It might be in the core study days that are not far away, or it might be in another way that we do it. But there are definitely areas, as you all know, where we can improve and must improve, and that's going to be challenging for us as well. And some of that will weave into the strategic plan as well. As far as the budget is concerned, we still don't know what the DHB or the Ministry of Health is going to flick our way, if anything. Um, so we're still sitting in a position where we have a budget. We've got some scenarios with some numbers that we've plugged in. But until we know those numbers from the DHB, we are as much in the dark as most of you are. We have managed to do quite a bit of cost savings in some of the areas, and there will be ongoing cost saving initiatives. I know that Julia, for example, with a number of other people, are looking at doing away with paper files as far as the patients are concerned. Great initiative. We're looking at reducing our photocopying costs significantly. The the reduction of laundry for Alsco will reduce prices. Obviously, there's some things that are already going to flow through automatically, and that's lower fuel costs. Um, We have cancelled some contracts, Sky TV, for example, the garden services contract, we've cancelled that. So there are a whole lot of other areas that we've done quite a lot of work on and continue to do some work on. The one thing that when we did present a budget to the board with those potential scenarios, was that we recommended that our lowest paid staff should be bumped up to the living wage, and the board have agreed with that. So regardless of funding, we will be paying our staff at the lower end of our wage structure with a living wage. So that's really positive plus for those people, particularly with COVID and some of the financial struggles that people are facing. Um, so yeah, every little bit will help, and it certainly will help those people who are at the bottom of our pay structure. So the living wage will make a significant difference to a few of those staff. Um, Not much else for me to say except, let's keep on talking to each other. Let's ask questions. Um, I did get some questions at the last Q&A, and it was mainly around rostering in the SPCU as well as the drug room, and we've got some plans in place to make sure the drug room becomes a little bit more efficient and tidier going forward. So um, we are taking those Q&As seriously, and want to see some actions as a result of people coming to have a chat with us. So have a good weekend, everybody. Stay in touch and keep on smiling. Thank you.